Hello friends, today in this video I will be discussing what is the weightage of each subjects, number of questions asked in anatomy, physiology or biochemistry. Okay, so the years they have conducted MRBs is 7, 9, 13, 17 and 2022, but I am for sure there is no separate there's blueprint. Okay, so even if you need, we can make out microbiology, this number of question can come like that, first year subject, second year subject, but in MRB there is no specifications, because as I have analyzed, so just I will inform you and so that you can also understand. So see, in year 2007, 19, 13, 17 and 22, so just see that in these years the first year subjects were, among the first year subject they have asked the anatomy. That too, in 2009 there was about 22 questions in anatomy, but in 13 it is reduced to 10, and in 17 8, and 2022 it is about 11. Okay, so there is no specifications and there is no separate blueprint is available. So these are the subjects, and you coming for second year subjects, you can make out. See, example I'm taking microbiology. So in first, 2007 17 questions were asked, and in 9 15, and in 2013 they have asked 23 questions, and in 2017 it had dropped down to 14, and again 22 it is about 28 questions. Okay, so coming for third year subjects, they are asking mostly from a PSM, but again in 2017 the question dropped to 2. Okay, so coming for fourth year subject, you can make out like in medicine 22, 30, 22, 14 and 21. Okay, so take home message will be like, there is no proper content or the proper weightage for any subjects, but one thing I came to know is they are covering a medicine mostly. Okay, see, the medicine has been top, like 22, 30, 22, 14 and 21. And coming for second subject, it is about the microbiology, like 17, 15, 23, 14, and last time it has been as 28. Okay, so I'm saying in first year subject, the more they are asking is about anatomy. Coming for second year subject, they have focused on microbiology and pharmacology. Third year subject, it is in PSM, and coming for fourth year subject, the medicine, surgery. Okay, and coming for what is that, periphery subjects. Okay, so we can't make out that. So, but I can say you some of the important topic in each subject. You must not miss the topics. Okay, so first we'll start with anatomy. In anatomy, they have asked what is the nerve supply. So you must be thorough with a nerve supply of each muscles, and what is the nerve root, and what is the clinical conditions like Erb's palsy, clumsy paralysis, right? So these are the main questions they have been focusing in. So coming for physiology, they have covered what is the most common component in extracellular fluid, intracellular fluid. Okay, so what is the action of oxytocin or the vasopressin? So the questions are not that much deep, they're very superficial, but the one thing is you want to cover all the topics. Okay, so if you're coming for physiology, just cover what are the action of the hormones, normal action of the hormones, and what are the components, that is in the extracellular fluid, intracellular fluid, like that. And coming for biochemistry, it is as you know, the rate limiting enzyme is important, and what are the cofactors for each vitamins, and what are the diseases caused by the vitamin deficiency. And another point is they have asked specifically about the heme synthesis and the what are the enzymes involved, and what are the diseases like acute intermittent porphyria, what is the rate limit, what is a defective enzyme, like that. So you concentrate in biochemistry the rate limiting enzymes, the cofactor for each vitamins, and what are the diseases caused by deficiency of these vitamins, and then heme synthesis. Okay, so coming for again pharmacology, the questions are very straightforward, like what is SSRI, So what are the drugs used for motion sickness? What are the, so mainly focus on drug of choice. Okay, so what's the drug of choice for giardiasis, and which is the longest acting PPI, what's the shortest acting? So the questions are very straightforward, and so you must not miss these points. You want to be thorough with classification and what are the important side effect of each drug, and what is the drug of choice, and what is the mechanism of action. Okay, so like that. So coming for pathology, in some question they have asked about the bodies. Okay, like Ashkoff bodies is seen in rheumatic heart disease, like that they have covered. But the important point they have covered in pathology is like they mostly covered sickle cell anemia and thalassemia. Okay, so like, so and then AML, CML, that you want to again here you want to know what is a translocation of the genes, and what are the specific main clinical features. Okay, and then so the what is that enzyme involved in each diseases, like that. So that point. And coming for microbiology, yeah, it is my subject. I know I have already put a detailed video for one-liners and the MCQs. So I covered the most of the points in that. If you go through that, it is more than enough. And friends, in this, so far in microbiology, they didn't ask a single question about the biomedical waste management. So we can accept the question. Expect these questions in this upcoming exam. I think they can ask in biomedical waste management because it is an upcoming topic, but not even a single question has been asked in the previous year examinations. Okay, so and another important point in microbiology is the regarding that so in rickettsia, you know that some diseases caused by rickettsia like Kawasaki, the tablet column is important, and they have been asked repeatedly twice I think. And friends, another important information is, and again I am posting a final video on microbiology for last minute revision, and in which I will be compiling all the important points like what is a bile strained eggs, non-bile strained eggs, and some important one-liners. Okay, so before exam, kindly go through that once, and also go through my videos. Okay, for MRB I have posted. I know single point I didn't miss anything for the MRB exams. I'm sure some questions will be asked from this. Okay, so I'll be soon putting my last minute revision video on microbiology in my YouTube channel, and please revise that once before the examination. So coming for forensic medicine, again here the question asked mostly on the poisoning. Okay, so the carbon monoxide poisoning, and they have asked about the that hanging and drowning. So the questions are very simple and straight. Okay, there is nothing clinical questions are there, but now but in this exam we can expect image based question series. As it is a computer based exam, we can get the image based questions. Okay, so in FM, so nothing serious, like they have asked straightly. Okay, the poisoning, regarding poisoning, what is an the antidote, and what's a cerebral poisoning, what's a cardiac poisoning, like that, and what is the manifestations of the OPC poisoning. So the questions are very straight, and so if you go through the main points, okay, it's more than enough. And again, coming for PSM, it is very important to cover all the points, like they have asked about the sampling and then studies, cohort studies, case control studies. So you must not miss this point. You want to study all the point, but you never miss this topic which I am saying, like studies and the sampling, and what is a recommended dose. Okay, the RDA, recommended dose for child and pregnancy, and what this question, friends, that there's a salt requirement. Okay, they have been asked twice or thrice, the same question has been repeated. Okay, so coming for ophthalmology, the questions is about like keratoconus and cataract. So I think just if you go through this topic, it's more than enough. Okay, like cataract and keratoconus, pterygium they have asked once, and so ENT, the question is like very what is a straightforward questions, and it is also easy. Okay, so if you're having, I think you'll be having some any notes now, and just you can go through that. So friends, I want to talk about the medicine briefly, because the in all the sessions, So till now they have their first priority is a medicine. In mostly they have talked about mentioned about jaundice. Okay, so jaundice you want to know in and out. That is an what is a Dubin Johnson, and then unconjugated bilirubinemia. So everything you want to make a detail, and they have asked about. So in medicine, another important point you want to know about is again the rheumatology. Okay, that is in rheumatology they have asked about that the bodies, that is an antibody. So you want to know every antibody. Okay, so like anti-Jo, anti-Ra antibodies for scleroderma. So there is a number of antibodies. So just you make it thorough. You must not miss this topic. Okay, that is a jaundice and then the antibody type. And then another important point is you want to make a differentiate between what is a bacterial meningitis and the viral meningitis. So again you want to make thorough on it. So these are the questions they have asked repeatedly, but the medicine is a top subject which I have been asked because it maintaining 20 to 30, and so it is up to the point. So I'm sure they will be asking medicine more questions. So coming for surgery, again it is they have asked the named procedure, friends. Okay, like Jabolius procedure for hydrocele, and they have asked like named operation procedures and what are the complication for these surgeries, and so what's the most common cause of peritonitis, like that. So what I want to say is please read the most common one-liners in all these subjects. Okay, so coming for OG, they have asked like what is the treatment for PPH, and how what is a contraceptive they have been asked. Okay, so what's the half-life for IUCD and copper T, like that. So so one question they are asking from IUCDs, that is an intrauterine contraceptive devices. So rest all of the topic, just you go through that. Okay, and then again there is a question on the what is that discharges. Okay, discharges, why discharges. And coming for pediatrics, like they have asked like what is the Apgar score, and what's the most common cause of bronchiolitis in children, and what's the most common cause of what is pain in children. So like that only questions. So what I want to know is just in pediatrics, just go through the malnutrition topic. That's the difference between kwashiorkor and the marasmus. That's an important topic. You must not leave the topic. And as I know, friends, there have been as you know, we want to cover all these subjects. The specific point I want to say, what the topic I am saying, please don't miss that topic. That is, and then immunization. Okay, in pediatrics they have asked about immunization and malnutrition, and another important point is that is an weight formulas and height formula. That's all. Okay, so you must not leave this topic. Coming for orthopedics, so questions were like what is a named fracture, friends, like there's a hangman fracture, right? So just go through the named fractures, and this again splint. Okay, so if you're having a vision book, they have a separate column for a splint. Okay, that is a named fractures and then splint. Please don't miss this topic. And for psychiatry, the question is like they have covered all, like OCD they have covered the phobia, and then what's the drug of choice for phobia, anxiety, and what's the most common used SSRIs. So like that psychiatric question has been little terrible, because we didn't expect see in the year 2013 they have asked 10 questions. Okay, so just go through like SSRI, what is a phobias, the phobias, named phobias will be there, and what's the treatment for OCD, anxiety disorder, panic attacks, and bulimia nervosa and anorexia nervosa. Please don't neglect these topics. So coming for dermatology, the questions was very minimal only, friends. So see in 2009 and 17 they didn't ask the questions, but in dermatology it is very the questions are very superficial, and it was a straight questions only. So coming for radiology, they have been asked that I want to know what is that named signs will be there, no? So just go through the named signs, and that only they asked that most of the full times. And another important point is about radioisotopes. Okay, so the isotopes will be using for the scanning, so just go through that also. So coming for anesthesia, friends, I hope like so same like long acting, short acting, which is a better muscle relaxant, and they have asked about that Halpix number and then Malampati score. Okay, so just you go through the named scores like that. So overall what I'm saying is for MRB, if you take, you will get an idea. So if you're taking an upper limb, so just what is an I'm saying in anatomy, just move on to do what are the muscle, what are the nerve supply. Action they didn't ask that much, friends. Okay, only once they have asked, and what's a nerve root, and what is an action, what is a complication, or what is a clinical condition. Okay, like that. So the questions are very straightforward and no need to worry. And even though they have asked the image-based question also, I think you have prepared for NEET. I'm sure you can deal with the questions. The only thing is, friends, I'm sure we can make out the medical questions because we are reading it from the we read for about 4 to 5 years, and you will be preparing for MRB. The one thing is you want to pass out for the Tamil eligibility test. Okay, so concentrate on that. And so what a topic I have mentioned in this video, please don't miss the topic. And again, for microbiology, I'll be posting a last minute revision video, and kindly go through that, friends. Okay, and thank you, friends. So all the best for your exams.